Check is proudly brought to you by First Capital Bank. Belief comes first.
11:41 right here on the House of Zoo. If you're just tuning in, my name is Soso. Pizza fella butter socks, and we're heading into the health check right now. On the line is Dr. Kieran Bhagat, who is a healthcare professional and practitioner specializing as a physician and a cardiologist, and always gives his plentiful time to come and help us take care of our bodies even much better. How are you, Dr. Bhagat?
Good morning. How are you?
I'm fine, thank you. How are you, sir?
Can't complain. I think summer is upon us, and it's nice to peel off all those jackets after a pretty tight, cold winter.
I agree. It is nice, but it's quite a shock, hey? It's quite a weather shock. But anyway, what do we have today to talk about, Mr. Bhagat?
Today we just continue our long series, because it's a long series, because there's much to discuss on mental health. And last week we talked about anxiety and phobias such as, fear of spaces, fear of public speaking. Today we're talking about a big subject which is actually more common than people realize. It's the subject of depression, and it is a common and serious medical illness that really can negatively affect how you feel and the way you think and act, and often goes unnoticed unless somebody actually says to the individual in question, that you have signs of depression, you ought to go and see somebody, because much can be done, but little is done because it's not picked up, or the individual or the patient is not referred for appropriate therapy. So people often ask, what are the symptoms of depression? Well, before we talk about the symptoms of depression, what are the causes of clinical depression? Well, a lot of things, stressful events, the last pandemic, most people take time to come to terms with stressful events. It's a bereavement, a relationship breakdown, or whatever it is. It may be a family history of depression. It runs in families. If somebody in your family had clinical depression where they were actually admitted into hospital, there's a chance that you may get, because we're beginning to understand the genetics of depression. We actually also know that a fair number of women, sadly, after birth, can develop what's called postnatal depression. So after the delivery, they have what are called postnatal blues. They just can't get out of bed. They're not tending to their baby, and they fall into this deep depression. And unless it's treated, it can actually result in real serious issues, either with the baby being neglected or the mother herself harming herself as a result of depression. So this is what's called postpartum after delivery depression, which needs to be picked up, because often it may go years where the mom just feels completely out of it, and nobody's told her that she's depressed. Loneliness can cause depression, and of course alcohol and drugs. If you're abusing alcohol or any other form of drug, it can cause depression as well. So the symptoms of depression, I said earlier before off air, we've had about 42 questions already. So I'm not going to get through all of them, but here are some of the questions that come up that are very relevant. Yes. Somebody's asked Naka, what are the symptoms of depression? The symptoms of depression are things like sleep disturbances. You can't get to sleep, or you sleep a lot. You don't want to get out of bed because you're so depressed, because there's nothing for you to get out of bed for in terms of depression. There's lack of energy, lack of concentration, loss of appetite. People have problems with self-image or confidence. They look in the mirror and they think, I'm really looking terrible. I don't deserve to go out. I don't deserve my wife or my husband. I don't deserve my job. They really get this sort of spiraling circle of negative thoughts going on, and sometimes there are thoughts of death and suicide. So these are some of the major symptoms of depression that can occur. Somebody's asked, what does depression do to your brain? Well, it can actually, believe it or not, it can actually shrink your brain. It can actually shrink the brain circuits that are closely connected to parts of mood, etc. So we've begun to actually understand that this is actually a chemistry issue. And somebody's asked, I get physical symptoms that may sound like depression. Are these suggesting depression? And they list them, and actually they are all signs of depression. They're vague aches and pains, things like chronic joint pains and limb and back pains, and occasionally your stomach plays up, you get tired, you get sleep disturbances, your appetite changes. These may actually, you go to the doctor and the doctor says, all your blood tests are fine, your blood pressure is fine, I can't find anything. Look to see whether it's actually something mental that's going on. Last question before you may have any is somebody's asked here a very important question: who is prone to depression? And actually depression is more than twice as prevalent in young women than men. Generally after the age of 15 up to 25 is the highest age group, and the lowest age group ironically is actually those as you get older, because it seems like you sort of weed out all the bad things, and once you sort of get into the afternoon of your life, it looks like you've worked out what things and how to manage your depression. So I'm going to stop there in case you have questions, but I can go on.
I think let me just ask you a quick question, because I've been wondering, right? I think I've come across a lot of people, right? You tend to have friends and relatives who go through such experiences in their lives, and the one thing that I always ask myself is, how do you recognize where there is depression? Because we always Google the symptoms, and it's not exactly what we relate to on the ground. You know, like we don't see these things on the ground, but a lot of us are really what we call going through it, and we never notice. So what are all of the signs, the real signs, you know, the things that we can say and point out to and say, no, this person needs a bit of help?
I think the most important thing, I mean, you've mentioned an important issue here, and the public needs to understand that there's a difference between sadness and depression. Everybody gets sad, you know.
Yes.
You've had an injury, you've lost a partner, you've lost a deal or a tender or whatever it is, and you get sad, and that sadness is understandable, and there's a point to the sadness, and in a couple of days or maybe even a day or so, it fades because you get on with life. Depression is the same things, unfortunately, but you can't get out of that rut. Say, for example, you've lost your partner, either from death or separation, and you can't get over it. So, you wallow in that. You keep thinking about it. You keep diminishing yourself of sense of worth. You lose appetite. You just can't get out of bed. And if this goes on a regular basis and begins to impair your day-to-day activities, then you need to see a doctor, because that may be sadness going into depression, and there are lots of things that can be done. So, it sounds very vague, and the world of mental disease is actually not like having flu. With COVID, you can do you can do a PCR test, but with sadness and depression, the doctor or the therapist or the psychiatrist actually needs to sit down and actually talk to that patient, which leads me to what is the usual treatment for depression. The usual and most successful treatment for depression is actually what we call cognitive behavioral therapy, where it's the gold standard, where a therapist or a psychologist or a psychiatrist will actually sit down with you, try and actually tease out where this whole thing started. And sometimes, very strangely, people go through what is called bipolar manic depression, where we'll talk about it on our next interview, where they go through highs and lows on a regular basis. They cycle through periods of mania where they sleep very little, they're agitated, they've got attention deficit, and then suddenly they dive into a deep depression. So the psychiatrist will actually pick up what type of depression you have, and if the cognitive behavioral therapy doesn't work, there are medications that are effective for most people with depression.
Yes.
The most important take-home message about today, because it's a big subject and I'm not a psychiatrist, is that there is treatment available. You need to recognize in some member of your family or friend, if they're having continuing symptoms of the things we've talked about, they need to seek therapy, because there is lots of treatment available, and people actually get back to a normal life on either drug therapy or cognitive behavioral therapy. One last question. I know we're running out of time. Somebody's asked you, are there any effective natural treatments available for depression? Yes, there are. There are lots of herbal remedies that can be tried, things like passion flower, chamomile, lavender. These are things that calm the brain. Some vitamins may be of use, vitamin B complex, vitamin E, vitamin C. These are all available, and they may actually help in terms of depression. So those are important things. One question that has been asked here that I do want to answer is, somebody's asked you, can exercise help depression? Almost certainly. If you're depressed and you exercise, you actually may boost your wellness chemicals called serotonin and dopamine. So get out there, take a walk with your dog or with your partner or just on your own, and get out into the sunlight. It actually does help.
Yes.
So those are questions. I mean, we could go on, but I mean, if you're going to give me some more time, I'm going to actually talk about one question. Somebody just asked here right now, why is it so easy to fall into depression? Well, some established theories suggest that low levels of transmitters in the brain can cause depression. And because we have an environment, particularly now, where, prices are going up, energy prices going up, fuels going up, gas going up, things of commodities going up, inflation is going up, people are actually getting depressed about the situation they find themselves in, just coming out of a pandemic. So there are lots of environmental issues that may trigger some of these issues, but there is readily available treatment from therapists, both in the public and the private sector. And I really would urge people, if they think that they have any of the symptoms that we talked about, to go and see your practitioner.
Yes. And I agree with that because I think that's one of the questions I would have had, that, you know, the experience that we have with mental, trying to get mental treatment in Botswana is quite difficult, hey? A lot of people don't know where to go, whether it's expensive or not, whether it's affordable or not. And sometimes some people have reported that when they do try to access these services, they don't get the appropriate help, you know? It's either they get put on medicine and then they become dumbed down, or the therapy just doesn't work for them. What can you say about that?
I think that's a really good point, and people do feel. I mean, the first thing to say is that some people are reluctant to go and see a doctor because they don't want to be labelled as being seen by a psychiatrist or psychologist. It's actually a taboo thing. Yes. But you know, really, and importantly, if you catch it early, there are good therapies available. And if you are not happy with, and that applies to anything in life, if you have a practitioner or a clinic that you're not happy with, change. You know, we're not living in the 19th century where you stick with one practitioner or one clinic or one facility. Yes. If you're not happy with the answers that you're getting and you're not feeling right, because remember, at the end of the day, the therapist is the therapist. You are the one that has the symptoms, and if your symptoms ain't getting better, it's not you that's wrong, it's a practitioner or the medicine that's not correct for you. And there are lots of ways to sort that out, and we have a big public sector and private sector where there are lots of therapists, and you can actually choose your facility, both public and private. So if you're not happy with any symptom, just change your practitioner. Don't be shy. It's your body and your health and your life.
Yes. You know, I'd like to sit here and talk to you about it the whole day, because I really always try to stress how important it is to have a good mental health. And, you know, a lot of people don't know a lot of stuff about what you just said, and the work that you do really does make an impact for that. Thank you so much, Dr. Bhagat.
Thank you very much. We'll chat next week.
Thank you so much, sir. And that's how we wrap up with the health check this time on the House of Zoo, man. And the health check, catch the health check every single Sunday from 11:40 to 11:50 right here, exclusive to Yarn FM, exclusive to the House of Zoo, man. Make sure to continue to enhance the effectiveness of your doctor's visits by listening into the House of Zoo health check every single Sunday. And that's how we wrap it up.
Health Check was proudly brought to you by First Capital Bank. Belief comes first.